Hello and welcome to this webinar titled Engaging Young People to Create Community Change. This webinar is a pre-learning community video designed to help maximize our time together when we meet in November 2017. Please pre-watch this video prior to our meeting so that we can head right to activities so that you can learn how best to incorporate these concepts into your practice. My name is Holly Raffel, and I'm a faculty member here at Ohio University's Voinovich School of Leadership and Public Affairs. I've been working on Ohio's youth-led prevention initiative for about 5 years, and there's a little bit of information about me on the slide, and I think it's important to have a picture so you know who is going to be speaking with you today. The primary objective of this webinar is to help adult allies be able to explain how the SPIF informs the worth of youth-led programs in Ohio, summarize the 5 phases of the SPIF, and describe how they connect via sustainability and cultural competence to create a continuous cycle. And this will lead us to our discussion at our face-to-face learning community about identifying core competencies, the knowledge, skills, and attitudes necessary to implement the SPIF with young people. So as you listen to this video and you watch through the slides, what I don't want you to think is, oh my gosh, I have to have a meeting and have my young people watch this video. In fact, that's exactly not what I want you to do. What I want you to do is think about how can I work with my young people to help them understand the key important concepts of this work and this foundational knowledge, and how can I present them the information at the right time in order to best support them in their process. I believe that you can actually help guide young people through the Strategic Prevention Framework, or SPIF, without actually showing them any of the background documents in the webinar that you are about to see. So challenge yourself to think about, what are those core competencies that I need to develop in my young people so they would be able to implement the SPIF? And what I don't want you to think of is having a ginormous SPIF training. I want you to think of activities or ways that you can develop those knowledge, skills, and attitudes within your young people. As we discussed in our first meeting, the overarching goal of youth-led programming in Ohio is that young people will collectively engage in a planning process to create and implement a strategic plan that uses evidence-based strategies to create community-level change. Our hope is that young people will be able to impact the greater community at large in whatever context that your group chooses. So be it underage drinking, or maybe misuse of prescription drugs, or marijuana use, or maybe you're looking at bystander intervention, or you're looking at a reduction of sexual assault. All of those very important issues can be addressed by young people in a way where you can think about it in terms of a community level change. The way we define youth-led programs in Ohio is that they're a community-based process in which young people determine a problem of practice, identify the root causes of the problem, and select and implement evidence-based strategies to address those root causes. It's important to remember that this definition didn't come from me, or it didn't come from any of the research team that support this work. This definition actually came from adult allies just like you. Adult allies who really thought about what's core to the work we do with young people and how we want them to become agents of change within their community. To break this down, what we are going to look at are ways that we can support young people using the Strategic Prevention Framework to determine a problem of practice, identify what's causing that problem of practice, and then, most importantly, select and implement evidence-based strategies to address those root causes. Quite often, what we hear young people, and adults for that matter, is they determine what's going on in their community, and then they immediately look to the internet or they look to resources to try and figure out how they are going to impact the problem. But if we skip step number 2, we're skipping a really important step that helps us identify what levers we have to pull that are really going to cause change in that problem of practice. SAMHSA has the Strategic Prevention Framework, and they believe that this framework supports accountability, capacity, and effectiveness. At its heart, SAMHSA's Strategic Prevention Framework, or the SPIF, is a data-driven process. What it does is exactly what this previous slide details. It uses data to determine that problem of practice and identify the root causes, which lead to the selection and implementation of evidence-based strategies. The best part about the strategic prevention framework is that evaluation is built right in, because if you're using data to identify the problem of practice as well as the root causes, then that data becomes your outcome measures. Of course, we have planning and implementation along the way because we have to plan those strategies and implement them. At the heart of SAMHSA SPIF are sustainability and cultural competence, and that's sort of the glue that hold things together because we want to make sure that whether we're assessing community needs or whether we're building capacity, developing a plan, or even how we implement our strategies and evaluate them, that we're keeping our community's best interests at heart. We want to make sure the work we do is culturally relevant and most importantly, that it's sustainable. We want it to be able to last over time. SAMHSA SPIF is built on the social ecological model, and here's a representation of that model. We know that a person's health and well-being is a function of themselves, and so they're at the core of this model. But a person's health and well-being is also influenced by those people closest to them, and that's that interpersonal circle, that's that second layer out. The third layer out is the organizations. So it could be schools, it could be programs that people are a part of, it could be the healthcare organizations which serve individuals. That also has an effect on a person's health. Finally, we know that individuals live in communities, right? And so our community, be it the environment, be it the built environment, the social environment, the political environment, that all plays a role on our health. And finally, policy. Policy is a very powerful tool in implementing health change, and we think of that in Ohio, particularly in a lot of the work our tobacco friends have done. And so we have smoke-free workplace laws, we have smoke-free schools now, smoke-free places of higher education, and those policies, because they have that punitive effort, do impact health behavior. So the SPIF encourages us to take a look at more than just how we're going to change that individual in a one-on-one setting, but how we can help the health of that individual and support them in achieving wellness through many layers of work and intervention. SAMHSA SPIF is also built on the public health approach, and this is the old epidemiological triangle. This may be old news to some of you, but I'm going to go ahead and explain it in case it's new. So the public health approach believes that health is based upon the agent-host environment relationship, and we must assess all three components and their interactions. So if we take a very basic public health problem like malaria, we know that the agent is malaria, the host is the Anopheles female mosquito, and the environment that mosquitoes breed in, usually wet, standing, pooling water, are also things that we need to consider. So if we want to stop malaria, one, we can change the agent or eradicate it. So people are working very hard to create a vaccine for malaria. We're not there yet, so we can also change the host. And so we do have a lot of chemicals that come in and they can actually kill those mosquitoes who carry malaria. However, sometimes when you try and kill the mosquitoes, you can also cause detrimental effects to human beings with those chemicals. So we also want to take a look at the environment and how perhaps we can change the environment. And we do that through recommending people who live in areas where there is malaria sleep with netting over their beds so they avoid getting insect bites, or they look at standing water and they make sure that they eradicate areas of standing water so mosquitoes can't breed. So basically, the public health approach says that we really need to think broadly and use our data if we want to change the population's health. Sometimes we change the agent, sometimes we change the host, sometimes we change the environment, and truthfully, most of the time we change all three. We can also take that agent-host environment model and extrapolate it on the epidemiological triangle of drug use. And so, much like the previous triangle you saw, we have the drug, the person who consumes the drug, and the context in which the drug is consumed. So we know if we want to end drug use, we can take drugs off the street and we can control that supply by, in prescription drug use, looking at prescribers and their prescribing practices. We can look at drug interdiction in terms of how we are looking at finding drug dealers and getting supply off the street. Another way to look at it is through the person. So, and that's called sometimes demand reduction, and how we want to make sure that individuals don't want or don't have a need for those drugs. So, what we're seeing a lot of now in our prescription drug epidemic is we're trying to find alternative treatment. So, we're looking at promoting physical therapy, yoga, other types of wellness, so that there isn't this need to jump to that drug and expose people to those opioid pain medications. Finally, we look at the context. We know, for example, I work at Ohio University, which is a residential undergraduate community, and we know that sometimes underage drinking can be an issue on campuses, and it's not unique to ours at all. So we have to look at the context, and maybe we need to change the context in order to change the behavior. One thing we have here is that not all bobcats choose to go out and drink to get drunk. And that's a really important thing. A lot of people say, everyone's doing it, everyone is drinking, so I need to drink. But we use a lot of social learning campaigns here with our young people at Ohio University to say that, it is not the norm. The majority of our bobcats are not drinking to the point of intoxication. And so we help people know that they can be reinforced in the healthy choices that they're making. But again, what this fifth challenges us to do is take a look at not only the person, but the drug, but the context. And sometimes we need to look at all three if we want to have the best chance of intervention. This is just a more advanced model of the triangle of epidemiology. And what lets us know is that we can extrapolate this model not only to individuals, but also to groups of people. And that is really the heart of youth-led prevention is we want to create community level change. And so most of the time, young people want to create that change within each other. And so they look at themselves as a group who want to change the behavior, health behavior, or support healthy behaviors in their peers. So we can take the epidemiological triangle and look at how do we change the health of a given population. And this model shows that we can definitely make that connection. So the premise is that if we use a public health model like the SPIF, we take a population focus. We're not just looking at individual care, and which is something that physicians or healthcare providers that are more traditional would do. Instead, we're going to place a lot of emphasis on creating healthy and nurturing environments because what we want to do is support behavioral, physical, and mental emotional health. We want to develop skills that are also going to enhance resilience. What taking a public health approach also allows us to do is balance the focus of problems with also the positive items that are going on. We want to look at both risk and protective factors. We want to mitigate our risks, and we also want to support and nurture our protective factors. So we really have to look at both if we're going to make a change. Four, we have to work collaboratively across a broad range of systems and sectors. The strategic prevention framework is really a challenge and a call to all of us to get outside of our silos and see how we can work together for community change. And then finally, that idea of cultural competence is really important. We need to adapt our implementation to local context. We see how many people are in the room. If you can remember back to our first face-to-face learning community and think back to that, people could choose the same problem of practice to work on and choose wide variety of different strategies to address that problem of practice based upon their situational context. So it's very important to take culture and context into consideration when implementing this BIF. So how does this translate into planning? We know that the SPIF outlines all the elements of good data-driven planning. It's called the Strategic Prevention Framework because it originated in SAMHSA's Center for Substance Abuse Prevention, or CSAP, but the reality is you could apply these to a broad range of issues, and it doesn't have to be substance abuse or behavioral health. It's just good planning. So when we look at the SPIF, we know the SPIF is actually a noun, and it's a public health model for intentional planning for achieving community level change. We know that the SPIF is data driven. We know that what we want people to do is identify a problem of practice, determine the intervening variables that are causing that problem of practice, and then select evidence-based strategies that are going to lead to both short-term and long-term goals. At its heart, this is what the Strategic Prevention Framework is. The SPIF's focus is on community development. That's where the capacity building piece comes in. Strategic planning for community level change. When we talk about outcomes-based planning, that's a data-driven process where evaluation is built in from the beginning. We know that effective strategic plans are grounded in a solid understanding of agent-host environment and their relationships. We need data in order to do so, to create our strategic plan. So therefore, this documentation of the nature and extent of issues is a critical piece. We need to determine those intervening variables. And sometimes intervening variables are called causal factors. Sometimes they're called contributing factors. Sometimes they're called why here, why now. Sometimes they're called the root causes. But what we know is that we can't create a strategy based upon knowing a problem of practice. If our problem of practice is underage drinking or marijuana use, we can't automatically go in and look for a strategy. We have to know why the underage drinking problem is existing or why we have a marijuana issue in our community before we can align strategies. For every intervening variable or contributing factor you find, you should be able to align a strategy to address them. When we do that, and only then when we can do that, we will impact our outcome variable or our problem with practice. Sometimes when we're out in the community, we hear SPIF being used as a verb, and I have a question mark there because it's something we really need to be careful the way we use the word SPIF. I hear people say, we spiffed our rally, or today we're going to spiff our next service learning project. And then I also hear something that's like, we spiffed our plan for reducing the incidence of binge drinking for high school youth in our community. This is using the SPIF in three very different contexts. What we know is that SPIF sometimes gets used as a synonym for intentional planning. And when we have activity-based planning, like planning for a rally, when people say, oh, I SPIFed my rally, it means that we were intentional and we sat down and we thought of every element we need in order to have a successful rally. Or we are going to go out and do service learning. We're going to go volunteer at a local women's shelter, and they need us to do a couple of things: develop kits for when during that intake process, but also develop activities for children, and also develop planning for pets who may need to be taken care of. When we do intentional planning, we want to make sure that we cover all of our bases so our event or activity is a success. That is good intentional planning, but it is not the SPIF. The SPIF is outcome-based planning. So when someone says, I SPIFed a plan to reduce the incidence of binge drinking for high school youth in the community, it's letting me know that they looked at a problem of practice in their community, they figured out why that problem was occurring in their community, and they really want to change and move the needle for that problem of practice. They want to reduce binge drinking among a specific population. Now, within that outcome-based planning that you see on that final bullet point there, we could have a rally to talk about underage drinking. And that is one activity if we need to increase awareness in our community. But planning all the action steps for the rally is not the SPIF. That is your activity-based planning, and those two things cannot be confused. So what exactly is outcome-based planning? Again, when we SPIF our planning, we have a data-driven identification of our problem And with that comes our specifically and clearly identified outcomes, not only for our priority substance or our priority issue, but also for a specific priority population. So we know what we want to change and who we want to work with within that change. It also involves the selections of evidence-based strategies and activities that lead to our intended outcomes and population level change. The SPIF is reserved for specific incidences when we want to use a data-driven process for community level change. So this arrow here is a depiction of what we've been talking about here. We have a problem statement, we have our intervening variables, and then we select our evidence-based strategies based upon those intervening variables. Because if we don't have a good handle on those intervening variables, we could select the wrong strategy. The classic example is for underage drinking, we have an access to alcohol issue. And one first thing that a lot of communities go to is they think they need to have server and seller training. So they go to their retail outlets and they do training with all of the people who serve or sell alcohol. And that is an intervening variable. If retail access is your problem, then you should be able to use an evidence-based strategy such as server seller training to decrease the amount of alcohol that's out there for consumption. So therefore, you should see a corresponding decrease in underage drinking or underage consumption of alcohol. But if your intervening variable is truly parents providing alcohol, you really didn't make a change, right? Because you focused on servers and sellers and retail outlets instead of the true source of the alcohol, which is parents and family members. We can't skip from problem statement to strategies. Time spent in figuring out those intervening variables, contributing factors, root causes is time well spent. The reason why we create this pathway that we just discussed is because it is a logic model. And some of you have heard the term logic model, and some of you have created them for your programs. So let's spend a little time thinking about what a logic model is. Here's a classic example of a logic model. This comes from the United Way. And we have our inputs, our outputs, and our expected outcomes. When we looked at this logic model, we saw that there was particular issues with this is that people were confusing their outputs with their outcomes. So we worked really hard with a group of practitioners to make this important distinction. In the logic model, there are two parts. There's the theory of change, which is the logic model, and that's the why we're doing what we're doing. We have a goal, we select strategies, those strategies lead to short-term outcomes, our short-term outcomes lead to long-term outcomes. And then we have our theory of action, which is our strategic plan, and that's the how. And that's our inputs and our outputs and our activities. It is important that we distinguish our theory of change from our theory of action. The theory of change is where we get our data-driven piece. Our theory of action is where we get our intentional planning piece. When we put a data-driven theory of change with intentional planning of our activities, we have a solid plan, and that's an important gift that we can teach our young people and will help us be able to impact our community. At its heart, a theory of change is if we do these strategies, we expect to get these outcomes. Expanded out a little bit, we map our theory of change. If we do these strategies, we can expect to impact our intervening variables, which gives us our short-term outcomes. If we impact our intervening variables and get our short-term outcomes, then we expect to get movement on our long-term outcomes or our problem of practice. So we have broad goals, we have our objectives, we have short-term outcomes, and we have long-term outcomes. And putting those together really helps us see the power of our strategic plan. In Ohio, we worked with practitioners to come up with a strategic plan map, and we will use this tool when we come together as a group, but we're also going to go over the components of it today in our video using our flipped classroom approach so you can get the content before you come into the classroom and practice the materials, and then you'll be able to review this video at the end to help pull things together for you. In outcomes-based planning, our problem statement or our problem of practice is directly impacted by our intervening variables. So we pick our problem or issue, we search in the data for why it's happening here, why now, that's our intervening variable, and then based upon those intervening variables, we know the appropriate strategic or evidence-based strategies we need to take. If we implement our evidence-based strategies, we should impact our intervening variables, and that is our short-term outcome. If we truly impact our intervening variables and get our short-term outcomes, then we should have a lasting impact on our problem of practice or our problem statement, and we will get our long-term outcomes. The beauty of the SPIF is that needs assessment and evaluation are intertwined. Careful thinking about the capacity we need to build in order to pull this off, the planning we need to undertake and implementation are built in the process. And if we are carefully considering cultural competence and sustainability along the way, then outcomes-based planning is strategic and lasting in our community. The strategic plan map can be broken down very easily. What we have on the bookends of are our problem statement and our data to support our problem statement. That's our problem of practice. So our problem of practice is the issue we're focusing on, as well as our priority population. That problem of practice translates into the far right-hand side of our strategic plan map, which is our longer-term outcomes, right? So for example, if we have an underage drinking issue in our community among high school students, then we would see that reflected in the data in the far left. Then of course, for our longer-term outcome, we would want to see a reduction in underage drinking among high school students. That is how our problem statement is connected to our long-term outcome. Moving one layer in, this is our intervening variables. These are our contributing factors. These are our root causes. These are our why here, why now. So if we started on the far left-hand side with an issue of underage drinking, we would have to come up with a series of intervening variables. So maybe it's parental permissiveness. Maybe it is social acceptability, right? We need to come up with strategies that are going to increase our parental disapproval of alcohol use. We need to show that drinking is not a social norm, so decrease that social acceptability. The intervening variables become our short-term outcomes. If we impact and choose evidence-based strategies that will change these intervening variables, we should then address our overarching underage drinking issue in our community. Again, the strategy is tied to that logic model because it's part of our theory of change. If we implement this strategy, we should impact this intervening variable. If we impact this intervening variable in the short term, we should then impact our problem of practice in the long term. So the strategy that we pick should be evidence-based and it should be directly linked to our intervening variables. In the middle is the theory of action, and this is where our intentional planning comes in. We have to take our strategies and we have to sort of give them hands and feet and make them really concrete. So what are we going to do to increase parental disapproval? Maybe we're going to do a media campaign. Maybe we're going to do a policy like strategy, like a social hosting law. We have to have the manifestation of our strategy explicated out in the theory of action so that we have a plan to follow as we move forward. At the top of our strategic plan map are space for us to explicate our theory of change. We do that in Ohio in terms of if-then propositions, and we've talked about that clearly several times in this webinar. If we do this strategy, we expect this change in our intervening variable. if we get a change in our intervening variable or our short-term outcome, we should see this change in our long-term outcome. We put that at the top so that anyone can look at your strategic plan map and understand why you are doing what you're doing. You can see where this would be really appealing to those who grant you the authority to do the good work that you do. It could be a supervisor, it could be a funder, it could be your community at large, it could be potential funders or potential supporters of your work. Having a clearly articulated if-then proposition or theory of change can help you communicate your work. We talked about how cultural competence and cultural relevance and cultural humility are important. The context is important. At the bottom of this page is room for you to write any important explanatory factors that help the reader understand your strategic plan. So why did you maybe choose the problem statement that you did? Why maybe were these strategies more important than others? This gives you a little bit of room to explain anything that you feel needs to be explained. So when taken together, your entire strategic plan map should articulate your group's work, your youth-led group's work in a single 11 by 17 page. When you have a single 11 by 17 page, you have helped young people collectively engage in a planning process to create and implement a strategic plan that uses evidence-based strategies to create community-level change. They're able then to take this plan, talk about their work, own their work in a way that helps them see that they are change agents in their communities. And that's the power of this work. And I've seen it happen with groups across the state, and that's very exciting. Your role now as adult allies is to think about how am I going to support young people into completing a strategic plan map? At what point do I show them the strategic plan map? What capacities do I need to build? What knowledge, skills, and attitudes do I need to build in my young people so they can think about community change in a very strategic manner? And we'll talk about that when we come together and meet at our face-to-face learning community meeting. Of course, for more information on Ohio Adult Allies, here's our social media sites as well as our website. If you'd like to look at more information about the Ohio Youth-Led Prevention Network, please visit these social media channels. We have references here if you'd like to dig a little bit deeper into our work. And of course, I am the one who gets to present on this webinar today, but there's a whole team of people that I work with in order to help design learning experiences for adult allies. So I would be remiss if I didn't thank them here. And most importantly, I would like to thank all of the adult allies that we've worked with over the past 5 years and the young people in Ohio who've shared their ideas to make this dream of youth-led programs in Ohio